Welcome to The Explainer. I am so thrilled you're tuning in today because we're tackling a massive, complex, and just absolutely fascinating topic. We are diving deep into the world of 2026 healthcare compensation. Whether you are a practice owner, a clinician, a medical coder, or honestly, just someone who closely follows healthcare economics, you already know the landscape is shifting dramatically right beneath our feet. So we went ahead and synthesized the latest data from major industry reports, like the Medscape surveys via Theo, Robert Half, Proactive Chart, and S10.ai, to bring you a clear, structured look at exactly where the money is going in 2026.
So let's jump right into the big question, really the core conflict of our explainer today. Are healthcare salaries actually keeping up with the true cost of saving lives? Across the board right now, we're seeing this massive tension between rising pay expectations from healthcare professionals and the harsh, on-the-ground realities of historic burnout, flat Medicare payments, and wildly complex administrative demands. It's a really delicate balancing act, you know? Employers are just trying to maintain margins while clinicians are desperately trying to maintain their sanity. Just think about this massive number, $386,000. According to the latest Medscape Physician Compensation Report, that is the average overall physician compensation in 2026. That includes base salary, incentive bonuses, the whole shebang. And on the surface, it's a phenomenal figure. It absolutely commands respect, but as we'll uncover throughout this explainer, that number definitely doesn't tell the whole story of what's actually happening in clinics and hospitals nationwide. All right, so here is our clear roadmap for the data we're going to break down today. 1. The 2026 compensation landscape. 2. Top earning medical specialties. 3. The primary care gap. 4. Non-clinical and allied health. 5. The burnout and turnover crisis. And finally, number 6, retention, perks, and technology. Okay, let's kick things off with Section 1, the 2026 compensation landscape. The immediate economic reality for doctors right now is honestly pretty tense. Average physician pay bumped up a modest 3% in the last year. But, well, when you compare that directly against the annualized core inflation rate of 2.7%, that massive $386,000 salary we literally just talked about suddenly feels, kind of stagnant. Real wages are barely growing here. And when you factor in that Medicare payments have actually seen a 33% decrease since 2001 when adjusted for inflation, you really start to understand why so many physicians are feeling a financial squeeze, even with top-tier incomes. Moving right along to Section 2, top earning medical specialties. If we follow the money, surgical and procedural specialties are absolutely dominating the top of the compensation charts. I mean, neurosurgery is topping out well over $760,000 on average, according to platforms like Doximity. Then you've got orthopedics, cardiology, radiology, and plastic surgery, all of them easily clearing that $500,000 mark. These roles require incredibly intense, highly technical interventions, right? And the compensation structures heavily reward that specialized expertise. Basically, if you want to maximize your earning potential in medicine, the data points straight to the operating room. Now let's pivot a bit. Section 3, the primary care gap. There is a glaring $117,000 gap between primary care and specialists. Primary care physicians, so family medicine, internal medicine, pediatrics, they're averaging about $287,000, while specialists are averaging over $404,000. So why does this matter to us? Well, because this massive financial gap is staring medical students right in the face while they're sitting on hundreds of thousands of dollars in student loan debt. This compensation disparity isn't just an interesting fact, it's a direct, measurable driver of the massive primary care physician shortage we're experiencing across the entire country. Let's look outside the physician realm for a minute. Section 4, non-clinical and allied health. This single number tells a really challenging story. A 1.6% projected average salary increase for all non-clinical healthcare roles in 2026, according to Robert Half. So while docs are getting 3% bumps, the folks running the revenue cycles, handling patient intake, and managing medical records, they're seeing increases well below the rate of inflation. Flat Medicare payments are just crushing employers' financial flexibility, which means super tight hiring budgets for the exact people needed to actually keep the clinic doors open. Digging into the specific mid-level salary ranges, we see a medical coding manager sitting around $74,000, while credentialing and intake specialists are down in the 40s. But here is the major takeaway for this group. Organizations are absolutely willing to pay a premium for specialized skills.
In fact, 79% of non-clinical leaders say they will offer higher salaries to candidates with business-critical skills. We're talking AI, workflow automation, and specialized credentialing. Honestly, if you're in this space, upskilling into digital transformation initiatives is basically your ticket to a higher starting salary.
And if we look at allied health, specifically physical therapists, geography is a massive variable. The national median is around $101,000, but out west, California and Nevada lead with averages well over $111,000. Meanwhile, a mid-range state like Texas sits at about $97,500. For the practice owners tuning in today, a competitive compensation package in Texas might actually offer better purchasing power for a candidate when you adjust for the cost of living, rather than trying to match those California wages dollar for dollar.
Which brings us to a huge hidden cost. Section 5, the burnout and turnover crisis. Okay, here is the massive psychological disconnect. Remember that $386,000 average physician salary? Despite earning hundreds of thousands of dollars, job satisfaction levels are at a decade low. 85% of physicians report being overworked, and 61% actually feel the profession as a whole is underpaid. No way, right? It really begs the question, how on earth can you earn nearly $400,000 a year and still feel undercompensated? Well, this quote from a survey respondent perfectly answers that. It is the crushing reality of excessive administrative burdens. We're talking insurance denials, prior authorizations, and what the industry painfully calls pajama time, charting and documentation done at home late at night, totally without pay. This lack of autonomy and overwhelming administrative friction is spreading like wildfire. It's actively driving burnout across literally all specialties, way more than the actual clinical patient care. And this crisis? It has a brutal financial impact on clinics. Just look at this number. $100,000. That represents the estimated annual lost revenue cost of just one single physical therapist vacancy in an outpatient clinic. In the PT world alone, turnover is hovering at 9%. That is more than double the healthcare average. When skilled clinicians walk out the door because they're completely exhausted by paperwork and crazy patient loads, it literally bleeds the practice's bottom line.
So how do we fix it? Section 6, retention, perks, and technology.
A competitive 2026 offer isn't just about throwing base salary at people anymore. It's about the total cost of ownership. It's about addressing the whole person. Candidates are aggressively prioritizing lifestyle perks and professional development. They want robust continuing education budgets like $1,500 to $3,000 a year, flexible scheduling, mentorship programs, and honestly, most importantly, manageable patient loads. Practice owners are realizing that giving a clinician, say, 60 minutes for an evaluation instead of cramming more patients in, sure, it might reduce short-term revenue, but it drastically cuts those long-term turnover costs. And the technology side of this retention equation is moving incredibly fast. A massive broader industry trend right now is adopting AI medical scribes and workflow integration. Tools like the ones from S10.ai are actually being used to listen to patient encounters and automatically generate the documentation. By adopting this kind of tech, you're reducing that dreaded at-home pajama time. It allows the clinician to actually maintain eye contact with their patients again, which ultimately drives up provider retention. Eliminating administrative friction is literally the best retention perk you can possibly offer in 2026.
Which brings us to our final thought for today. Whether you are out there negotiating your own salary or you're the one designing a compensation package for your staff, you've really got to ask yourself, is your strategy built for the whole person or just their wallet? Because the data is crystal clear. In 2026, paying top dollar just isn't enough if you're also burning your people out. Thank you so much for joining me on this deep dive in the Explainer today. Take these insights, rethink those strategies, and I will see you next time as we continue to unpack the data that drives our world.